Hi, my name is Francois. I'm Director of Advanced Urological Care. And my practice is focused on the treatment of advanced erectile dysfunction with penile implants. But today I want to speak to you about oral medications, treatment with pills for erectile dysfunction. Now, I was extremely fortunate in that I was able to participate in the early clinical trials with pills such as Viagra and Cialis. So I developed a lot of experience with these medications. And in the beginning, we were testing Viagra at different doses, and I had 20 patients in my clinical trial taking this pill that eventually became Viagra, and noticed that the medication was extremely effective very early on, but it did have some side effects. Most patients who take Viagra who have either moderately severe or severe erectile dysfunction will require a dose of about 100 milligrams. And patients who have mild erectile dysfunction will do well with a dose of about 50 milligrams. Now, what's interesting is that the older the patient, the sicker the patient, the fewer the side effects. The younger patient, the patients that have healthy cardiovascular system all over their body will have a lot of side effects with these medications, which include headache, stuffy nose, heartburn, and flushing of the face. Now, Cialis received FDA approval a few years after Viagra and shortly after Levitra. And Cialis is a little bit different. They all work the same way, they all block the same enzyme. However, the nice thing about Cialis is one can take Cialis with food or alcohol and it will not interfere with its absorption. With Viagra, you really, to get the maximum benefit of the medication, you should take it on an empty stomach. You should wait 6 hours before taking the pill, and then you have to wait an hour before having sexual activity. Now, that requires planning, and it's one of the drawbacks of this medication. Cialis, on the other hand, you can take with dinner, wait about an hour, and then have sex. You can also postpone sex since the drug will stay in the body for about 36 hours. So you could take the pill on Saturday night and then have sex Sunday night or Sunday or Monday morning. The other benefit of Cialis is that taken at small doses, for example at the 5 milligram dose, if you take it every day at the same time, at the end of the 5th day, it's as if you took a 20 milligram dose. And the nice thing about the daily dosing is that you don't have to plan for anticipated sexual activity, and you also have the added benefit of being able to urinate a little bit easier, and it also decreases the frequency of urination. So for many of my patients, the preferred medication is the Cialis at the 5 milligram dose, which kills two birds with one stone, so to speak. Will take care of the urinary frequency, which is often associated with erectile dysfunction, and the erectile dysfunction. Levitra is very similar to Viagra, and in my practice has not really offered any benefits. And the newer last to the market, Stendra, is also a medication that can be prescribed, but again is very similar to Viagra or Levitra. Supposedly it's supposed to work a little bit faster. In my practice I haven't really observed that, and most patients prefer the Cialis because of its attributes of absorption that can be taken with food, and because it reduces the planning and gives you a longer period during which you can engage in sexual activity. Thank you.